Dr. Zhang, good morning.
Hi, good morning.
Hi, good
Good to be
morning.
here.
Nice and clear. Thank you so much for being here, Mandy Zhang. So, Mandy, we are recording this conversation for my podcast about women's health after 40 and in menopause. So, I'm very, very interested in a conversation with you. So, thank you so much for being here, Mandy. Mandy Zhang, before starting the conversation, could you please introduce yourself, what you do, who you are, and why do you do what you do?
Okay, hi, I'm Mandy. So I'm a sports physician from Singapore. And I'm a deputy director for the training and education for Exercise is Medicine Singapore. I think in medical school, we don't quite learn about how exercise can be a complementary treatment for a lot of diseases. But over the years, we have seen that actually, if you use exercise in the right amount, the right volume, it can actually be a form of preventative and as well as a management option for a lot of chronic diseases.
Okay, so Mandy, I ask you to put the computer a little bit lower so I can see your face. Thank you so much. Also for the audience, thank you. Let me give a short message to our audience in Italian. La dottoressa Zhang è venuta a Lugano, qui dove vivo io, proprio questa settimana, grazie a IBSA Foundation, perché ha invitato la dottoressa Zhang a partecipare a questo corso universitario Medici e Prescrizione Sociale, proprio per dire che i medici prescrivono non solo medicine, ma anche dei consigli importanti per vivere meglio. So, you came here in Lugano at the university. And you explained, I think, doctors and people that sport can be a medicine, right?
Yes,
So
that's right.
how does it happen? What does sport make in our body?
Yeah, well, there's a lot of good effects that comes with exercise and sports. If we are looking at our blood vessels, it helps to vasodilate or relaxes the blood vessels. And so if you're someone with high blood pressure, it can help to lower your blood pressure. By exercising, it also helps to efficiently pump your heart better and more efficiently. And of course, exercise also helps to improve the immune system. It helps to suppress any pro-inflammatory cytokines, and also boost any anti-inflammatory chemicals and cytokines. So I think there's multiple effects of how exercise can help. Exercise even helps to give us the happy hormones, so that it increases our endorphins or the happy hormones, and that's why people after exercise do have a exercise high right after.
Yes, so actually, women after 40 suffer from many things that you explained. It's not that menopause is a disease, of course, it's something that happens biologically. I'm very curious about how is menopause considered in the Eastern society. Is it something
Mm.
that comes for good? Because many people, many women know that. Sorry if I ask you something that is extra your curriculum, but I'm happy to do this conversation because how is menopause considered in your society?
Yeah, so maybe I'll put it for first and foremost in my sports medicine setting. I would say managing menopause women is not the main patients that I deal with, but I do have a lot of patients in their 40s to 70s, women who come in with maybe menopause related conditions like osteoporosis. Um, and also sometimes they would tell me about urinary leakage with exercising, or some hot flushes that makes them a little bit less comfortable in the heat in Singapore and the humidity. Yeah. But maybe if I just reframe your question and think about how menopause is viewed in our society, I think there's a lot more to be done. I'm approaching 40, so I anticipate that this is going to hit me really soon. But I think a lot of women in my society, they do think that it's just a rite of passage. It's something that will happen. And so therefore, I think women, they have a mind of their own and they're really relatively, strong-minded and a strong character. And they take childbirth as a given, they take menopause as a given. And although they do have symptoms, I would say a very small minority actually seeks help. And I think there is a lot more education that we need to do for our women out here to help them with like vasomotor symptoms like hot flushes, night sweats, and let them know that they're not alone in this. Yeah, maybe in our society, there's also a element of using alternative medicine.
Yeah.
So sometimes complementary medicine or traditional Chinese medicine may be something that they turn towards too, rather than seeing a Western medicine physician for hormone therapy.
Yes. So that's a great debate on it because there's many women that don't want or can't take hormones, so they absolutely need to know anything about what else they can do. And for sure, sports is something that helps women. I'm curious about symptoms by symptoms. Okay, so let's talk about anxiety and depression. Is something that you touch a little bit. Women in menopause can suffer from low mood or up and down. So what can sports do in this situation? And also about you already said hot flashes, but also many women have belly fat and fat around the body that changes the body composition. So you talk about vasomotor consequences, but also how about mental and body composition?
Yeah, so there have been quite a few studies that show that exercise and sports actually help with quality of life. And also, it does touch on certain anxiety and depression symptoms that come along with it. And we find that in multiple studies with, anxiety and depression, aerobic exercise, so like cardio exercises do help. And we do recommend about 150 minutes of moderate intensity exercise per week. Mind and body exercises have also shown to play a good role in quality of life and depression, anxiety. So this would be things like yoga, Tai Chi, or Qigong. And with the mind-body exercise, usually the exercise is done in a very slow, steady, like a flow state, and then the mind is always focused. So I think it always brings the women back to the present when they do such exercise, and it seems to help with some of their mood disturbances. The other thing about central adiposity and fats, yes. So we do find that, at a menopausal age, it's often harder to lose weight. A lot of metabolism, we see that there is a dip in the metabolism. So for those kind of patients, for sports, we tend to recommend both aerobic exercise and strength training exercises. So it's a little bit harder, but with the strength training, it helps to boost the metabolism. So the muscles are a little bit more effective in utilizing the energy and the food source that we take into our bodies.
There's not many women that want to do heavy loads or to lift weights. There's a lot of misunderstanding about that. So I would like to go deeper on this recommendation. So let's take a week of a woman, around 40 or in menopause, good health, so nothing to consider. How does she put in the agenda appointments for movement to feel better? So she has to do 150, you said, at least cardio exercise. So what does it mean? It means 20 minutes per day, or I can do three times per week, or I can do one amazing, incredible marathon a week. So let's go deeper about that. And then give me, please, a recommendation about strength training in this ideal week.
Yeah. So I wish I could give you the best formula, but I think at the end of the day, when I prescribe exercise, I often go through my patient's daily schedule. So I actually go into asking, what time do you wake up? When is breakfast? When is lunch? What do you do in between your work day? And what time do you end work? What are your other family commitments? Because I think as a physician or someone planning exercise, I need to make sure that whatever I say actually fits into their schedule. And I find a lot of doctors, if we do not delve into the patient's daily schedule, then it becomes very prescriptive and it's almost like just regurgitating
Yeah, I must
the
do
excess
that.
prescription. Yeah, and the compliance is very low. Yeah. Maybe if I give you an example or like an ideal situation, I would say that if they could go to the gym at least 3 times a week, and then leave about so 3 times a week in the gym where they do 30 to 60 minutes of cardio.
This means
And
cardio on the elliptic machine, or maybe the treadmill, or cycling, right?
yes, so cardio can come in different forms. We can rate it from low impact exercise to high impact. For the low impact, that's usually non-weight bearing. So things like rowing, cycling, those would be low impact. And then moderate impact aerobic exercise would be something on the ellipticals. So you're on your feet, but you're not pounding on the platform. And then a high impact aerobic exercise would be like running. So I think it also depends where you feel comfortable with. Yeah.
Okay.
And to hit
Sorry, can cardio be also a class in the gym, right? So it can be a dance class or anything related to moving and sweating, right?
Yeah, absolutely. So yeah, but there's so many classes out there. Yeah, as long as you're on your feet, you're moving, that could also count as a cardio. But a lot of this, I would say hybrid classes that you mentioned in the gym, dance classes, they tend to sometimes incorporate a little bit of cardio with strength, right? And then so it's a little bit more a combination of exercise. Yeah.
Okay.
Then again, I would individualize to what my patient likes or what the lady likes and customize to their preference.
Okay, so if I don't go to the gym, maybe I don't have money enough or I don't have time, so I have to squeeze the cardio exercise at home. Can I do this at home yes, maybe I can go out and walk simply.
Absolutely, yeah. So I think brisk walking would be something that is convenient, free. We just so often what I sometimes do is I look at my patient and ask, where do you stay? And then I find a little park that's around them, or like, within their vicinity, how long would it take for them to walk around? So I think exercise has to be planned, it has to be structured. Um, and it has to be intentional. So we have to give planning to it. And brisk walking is easy to say, oh, just walk 30 minutes. But if I plan, okay, walk from here to here, that would be about 30 minutes, or that would be about 2 to 3 kilometers. I like to give that kind of structure to my patients.
And it's very nice if you think I do maybe 15 going and then 15 coming back. So it's like halfway, one and halfway. So also I can't stop in shops. It's not that I don't talk with anyone. I just go and never stop, right? Otherwise, it's not cardio anymore.
Well, in the past, based on the American College of Sports Medicine, they used to categorize exercise as a minimum bout of 10 minutes. But
Okay.
I think in more recent years, we have decided that something is better than nothing.
Yeah, of course.
So if you have to stop, talk to somebody, if that makes you happy, makes you connected to your community, then I think, it's like a little pause on your watch, smartwatch to say, okay, I've taken a little break. My 10 minutes of talking is not considered. Um, but then I will start the clock again once I start walking.
Thank you. This is very wise. Also, another thing I need to ask because I want to make sure that everyone understands very well what we are talking about. When I say cardio, I can breathe enough to speak. So, what kind of intensity I have to reach to do a proper cardio workout?
Yeah, so I think what you're talking about is the talk test. So talk test is a gauge of intensity, and the intensity we gauge it, we rate it according to low, moderate, and vigorous exercise. So maybe I'll take the moderate as an example, and then it gets easier to relate to what is low and what is high. So when it is a moderate intensity exercise, when you're doing the exercise session, you're able to still speak to your friends, but then you'll be breathless while if you'll be breathless if you were to sing.
Okay.
And yeah. And then if you're doing it in the low intensity, this should be something where you can still sing and you can talk. So it should be very, relaxed and chill. Yeah. And then for the high intensity, that would be if you can't talk and you can't sing. So it will be like breathless while trying to make full sentences. That would be a vigorous. Now, everybody would experience exercise quite differently. So for someone who is very well trained, running up a flight of stairs would be a moderate intensity. But for someone who is sedentary and just doing it for the first time, they may actually gauge it as a high intensity for them.
So
Yeah.
which is the threshold where I burn fat, actually? Is it the lower, the moderate, or the vigorous one?
Okay. So again, I wish I could give you a best fit answer. The best answer would be moderate intensity, the
Okay.
middle zone.
So,
But the caveat is if you're starting something new and you're doing it for the first time, it's always good to start low, go slow. So you can always start with low and then slowly progress once you get fitter. And that is my recommendation.
I think it's very compassionate the way that you're explaining this thing. Also because it's not easy for people, especially for the ones who are not moving, to feel
Mm.
that this is like recommendation and like orders. Do this, do that. So it's very compassionate and wise. Thank you so much for this kind of mood. But it's nice to see something very concrete. So right, if I talk to my friend and we can't sing, we're like, oh my god, we're burning fat, this is amazing. So this is something that we can maybe experiment with our friends while walking. So the other thing, out there are many people also in the social saying that it's very good for the women around 40 and in menopause to lift weights. They say that muscles are very good for metabolism as well. And also they apparently they help us burning fat. Is it the right thing to say?
Yeah, so the muscles are like our energy, our factory that helps to burn fats, and you want to build that metabolism. So there are three kinds of strength training that I tend to prescribe. The three types are body weights, free weights, and machine weights. So body weights would be doing things that you don't need equipments for, and you're using body weights for planks, for squats. And then for free weights, you're using things like barbells or dumbbells, right? And then machine weights are things that you see in the gym, where you have that machine and you're doing a let's pull down or you're doing a leg press, for example. So for a women above 40, I think it's always good to get a little bit of help if you're not too sure how to use machines, because it's important for someone to give you the right techniques and give you the right cues. But if I were to choose any of these three in terms of safety, I think I'll go first with body weights, because often people are quite comfortable with managing their own bodies, and then move to machine weights, and then following up by free weights. So kind of like a graduation to managing strength training.
Of course. So talking about body weight, so our body has a weight, of course, and we need to challenge gravity, right? So if we lift our body, what does it mean? That we do planks, you said. So what are the other exercises that challenge our body?
Yeah, so we need to think of large muscle groups and thinking from head to toe. So planks can come with, just standard planks, side planks. We can do squats, we can do lunges. And there's different kind of modification, but I would say those are some of our usual ones that we use. And then, with planks, you can always go on the side, and then you can have lift one leg up. So there are different variations that we can incorporate. But if you were to start, I would say planks, side planks, squats, lunges, those would be kind of like your basic few. And then sometimes you can then add free weights, dumbbells by your side, and then, to do the same exercise just to increase the intensity and also increase the complexity of the exercise.
So yes, that's the thing I'm interested about the volume and also the intensity of what I have to do to make it progressing and effective. So what are the rules, if you can say that, or the recommendation for this kind of strength training for a woman or a person
Yeah.
over 40?
So for strength training, I usually recommend 8 to 12 repetitions, 3 sets. So for example,
Let's start with the
do
squat, which is
a
still.
squats, yeah. If we do the squats, then I want you to do 8 to 12 squats. And then you can take 30 seconds to 1 minute of break, and then repeat it the second set, take another break, and then repeat the third set. So it will be a 8 to 12 reps, 3 sets. And that would be my general rule while starting. Yeah. Now, it's different when you're using, say, machine weights where you're pushing against a load. So often how we move around that would be 40 to 60% of your 1 rep max. What this means is, if you try and push against a load with full force, and you can only push it at, say, for example, you can push something at 100 kilos, right? And that would be your maximum that you can do for 1 rep before you fatigue and you tire out. Then I would then break down the load to about 40 kilograms and then push it again for 8 to 12 reps, 3 sets. So that would be somewhat like a moderate intensity, like a recommendation to hit. But my same rule apply. If you can't hit that 40%, always feel free to drop down to 10 or 20% and then slowly build up. So, to the optimal dose.
So what does this kind of week, so I can do, maybe we didn't say how many things per week we have to do this body weight exercise or this resistance training. Is 2, right? 1 to 2, or maybe
Yeah, so that's a good question. So generally I would recommend for 2, and for strength training exercise, it's also important to keep some days in between each session. So for example, if you do a strength training on Monday, I would do the second training on a Thursday or Friday. And the reason behind that is that after strength training, sometimes we go through this process of DOMS, DOMS, which is a delayed onset muscle soreness, where the muscle fibers undergo some minor trauma, there's muscle breakdown, and then you feel quite sore. So you want to give some time for the body to repair before going on to the next bout of exercise, so that, you know, when you're hitting muscle, when you're doing exercise training, your muscles are building up. And then because of the heavy bout, you start to get a little dip. But with the recovery, it goes up. And then you try to come back in at your peak so that you get a good overall improvement in muscle toning and muscle strengthening.
So ideally, we can burn fat and then be toner. So this is a amazing thing, amazing
Yeah.
prospect. So how about injuries? Because you said, okay, this is an ideal situation, but if a woman after 40 or maybe in menopause can fall down or maybe be breakable, because we talk a lot about osteoporosis and bone density. So how can I prevent frailty and injuries by sports and exercise?
Yeah. For osteoporosis, fortunately or unfortunately, the process starts in your adolescent years, in your teens.
Kidding
Okay.
me?
So why I say that is that our bone mass, it peaks at about 20 years old, in our 20s. So we need to get good bone health in our teens and early 20s so that we have the best bone health in our 40s and 50s.
So this means
And
back to exercise when you're young, right?
yes, yeah.
Yeah.
So if you're a woman with kids, then get your daughter to start early because that's important. Yeah. But nonetheless, if we're already in our 40s and 50s and that's where we are at present, then osteoporosis, it's a silent disease. And it means that most women don't know that they have osteoporosis until they have a fall and they sustain a fracture. And when they see the doctor, they realize, okay, the bone is weak, the bone is porous, or there's low bone mineral density through a scan. So the best kind of exercise for osteoporosis is weight-bearing aerobic exercise. So remember when we talk about aerobic, we spoke about the low impact, moderate impact, and the high impact. For women, I would recommend either moderate to high impact exercises. So this may mean at least an elliptical, if not weight, or if not, then brisk walking. And then if they are used to jogging, they can also continue with that exercise because the weight-bearing exercise will help to build stronger bones.
But also we hear a lot over there, or out there, not over there, that maybe a lot of cardio, like running a lot, can get women very tired, because at this age, when you're 50, 60, there's not so many energy. So how can I choose the right exercise not to finish my energies, but still work for my body, my bones, and my health?
Yeah. So I think it's really important for someone to listen to their own body. You want to make sure that the bout of exercise makes you feel good, refreshed, and happy. So if the bout of exercise makes you really tired, make you unable to sleep at night, then I think we need to relook into what you have been doing. So I think at the end of the day, everyone's quite different, but always touch base with yourself in ask yourself how you feel after this bout of exercise. What is your satisfaction level? Yeah. And the other form of exercise would be the mind, going back to the mind and body, because I think that really brings you back to present, yoga, Pilates, Tai Chi, those are weight-bearing exercises, and also it helps to keep the women in present. I also wanted to bring up one point when you mentioned about falls. So women above the age of 40, 50s, in addition to the aerobic and strength training, balance exercises are also important. So, getting them to be comfortable on different surfaces. So, for example, they may be quite comfortable on concrete floor, but if I put them on a mat or like on a uneven ground, bring them to the trails or put them on the, in the gym bosu wall, they may feel unsteady. So this comes with a little bit of training, and often through some exercise prescription, I'll get them to emphasize on balance exercises. So things like standing on one leg, standing in tandem with one feet in front of the other. And balance is actually made up of three components: the eyes, the ears, and the muscles. So sometimes I even get them to close their eyes while balancing, just to test whether if I switch off one senses, are they still able to manage their footing? Are they able to manage their balance? And you can imagine if you're at home and if it's at night, you drop something, there's no lights and you're trying to pick something, like you want to make sure that the lady is able to not fall because she's trying to pick up something and they have lost light in that sense.
That's very, very interesting. I have two last questions.
Yes.
Nutrition and also supplements. I know maybe this is not your field, but what do you suggest to women starting exercise and also trying to do the best for their bones and muscle density, maybe resistance? So is there basic supplements that we must have in our counter?
Yeah. Well, I guess in women above 40, there's many issues that can hit them. I'm actually
Yes, I can tell many.
yeah. Yeah, and I mean there are different supplements out there. Again, I don't quite prescribe supplements. I'm actually a proponent of real food.
Okay.
So I love my women and all my patients to, as much as possible, take real food from non-processed forms, rather than depending on supplements if not required. Now, if it's a medical condition and they need topping up, so if their calcium levels are really low, their vitamin D levels are really low, then a supplement may be necessary. And in those cases, I think for bone health, calcium, vitamin D, those are my two go-to to top up. And before doing any of this, sometimes I would also make sure I do a blood test.
Yes, of course.
Before supplementing them. If they're otherwise healthy, their risk is relatively low for osteoporosis. So sometimes I screen to make sure that they are not smoking, they are non-drinkers, they do not take steroids, and they don't have a family history of menopause in the family, osteoporosis in the family. Then and those are all clear, then I would say, okay, go for your good calcium, your dairy products, yogurts, cheese, and vitamin D comes greatly from the sunlight. So, spend some time in the sun between 11 to 2 p.m. And interestingly, mushrooms, if you sun the spores in the mushrooms and keep them exposed to the sun and you go and cook them, it actually absorbs the vitamin D into the mushroom for increased vitamin D levels.
Thank you so much for
So
this advice. I guess
yeah,
it's life-changing.
yeah.
Thank you so much.
And vitamin D also comes from fortified bread or fortified milk. You may find this in the supermarket, and this will help to boost vitamin D levels.
Amazing. So before saying bye, and we got 5 minutes, is there anything that we didn't say that is very important, like a message you want to bring to the Italian audience?
Yeah. Well, I think exercise is medicine. Exercise is good for overall health. I hope that you'll be able to commit some time to work around the schedule, to build in balance, to build in aerobic and strength training into your routine, for better health, happiness. And yeah, always happy to share more about exercise is medicine, or how sports is medicine to the Italian family and team whenever necessary.
So let's see what comes back, and then maybe we can arrange another call. Thank you so
Sure.
much. It was really, really amazing meeting you. You're a very incredible person, professionist and woman. Thank you so, so much.
Welcome, and it's a pleasure meeting you. Thank you so much, Silvia.
Ciao, ciao.
Okay, ciao, ciao.